Live from San Diego, this is the Fox 5 News at 4.
We're getting new details this afternoon about the death of a 20-year-old Disney star who died over the weekend. Cameron Boyce's family says he suffered a seizure Saturday night and died in his sleep.
TMZ is also reporting that he was being treated for epilepsy. Boyce starred in the Disney Channel show Jessie and the Disney movie franchise The Descendants. He was also in the movies Mirrors with Kiefer Sutherland and Grown Ups with Adam Sandler.
And joining us around the table to talk about epilepsy and as well as seizures and signs to look for, Dr. Richard Chaffoo.
Yeah, Dr. Chaffoo, thanks for being here.
Thanks, Jen.
All right, TMZ reporting this, but what do we know so far about epilepsy? And I think the story making so many headlines and people are talking about it because this kid's so young, he's 20.
He is young, Jen, and unfortunately epilepsy is the fourth most common neurological disorder, but it's most common in younger people, so in children and young adults, but it affects men and women equally and essentially any race group. So it's a very common disorder, very common neurological disorder.
This is something that people know that they have. I mean, this wasn't like a complete shock out of left field, right?
Exactly, and from what I understand from the story is that he had already had this diagnosis and obviously had been under treatment, but we do know that this is a central nervous system disorder, and what happens in these people, Andrew, is that there is an abnormal firing of brain impulses, and your symptoms depend upon where those nerve impulses are firing. So you could have something called a petit mal seizure, which essentially you might be sitting and all of a sudden begin blinking slowly, quickly, or you might have a sudden stare, and then we all know the grand mal seizure, which are those tonic-clonic movements that are very very frightening to the public and can be significant injury can occur in these situations.
What's the rate of death from epilepsy? I feel like I've heard people have seizures or they know they're epileptic and they carry around medicine like I could have a seizure, but I don't oftentimes hear of people actually dying from them and certainly dying in their sleep.
You don't, Jen. In fact, the studies out there seem to indicate that this sudden death of unexplained association with epilepsy is 1% or less. Researchers are still really unsure as to what causes it, but we have to remember that the brain is a control center for our respiration, or control center for our heart. So the theory is, at least, that there may have been a problem with his respiratory control, perhaps stopping breathing or some life-threatening arrhythmia that had occurred.
So you say we don't know what causes it. It's something people are born with, that they develop at a certain period in their lives?
At least half the people, Andrew, there is no known risk factors, but in the other half of people, we think there may be a genetic tendency. We know head trauma may be associated with epilepsy, certain prenatal injury, brain infections, strokes, developmental disorders are the other half, or the other 50% that we can trace.
Those people
to
don't find
comparable.
that they're epileptic till later in life at times?
Exactly. They
Or just noticing the symptoms?
Or
Like
just
I think
begin to notice
something's
the symptoms. And they can be very, very mild. And so very early on, we may not notice that someone has that. So it's very important, obviously, to pay attention to repetitive symptoms like this.
Dr. Chaffoo, always great to have you around the table. I wish we could talk to you on better circumstances instead of talking about the death of such a young person, but we appreciate the insight. Thanks.
Good information. Thank you so much.
Andrew.
Appreciate it.
Sure.